वेलकम बैक व्यूअर्स ऑन हेल्थ मेटर्स। मैं हूं आपकी होस्ट सारा अंजम और हम बात करते हैं डॉक्टर लोधा के साथ ऑन कि हाउ टू प्रिवेंट हाई ब्लड प्रेशर एंड डायबिटीज़ विद एक्सरसाइज। हम और जानेंगे डॉक्टर साहब के साथ। यस डॉक्टर। सब ब्रेक से जाने से पहले हम बात कर रहे थे कि डायबिटीज़ को, हाई कोलेस्ट्रॉल को, ब्लड प्रेशर को लोअर करने के लिए एक्सरसाइज ज़रूरी है। कुछ लोग जिम नहीं जाते या वॉक नहीं करते, सो इफ़ दे have a routine walk, will that help them to lower these diseases?
Again, walking is a very good terminology, but depends how much you walk and how can you walk also. You know, first of all, it depends on person to person. If अगर कोई मेरा patient है who is 80-90 years old और उसमें उसको बोलूँ कि भाई you do lot of brisk walking and you know which he cannot do it also. Okay. So again, depends person to person, but definitely, you know, walking, people should not take walking as a leisure, and when they walk, it should feel them they are doing some exercise.
जी.
Okay. बाकी तो ठीक है, वॉकिंग तो हम भी सब जने बहुत करते ही रहते हैं, दिन भर चलते हैं, किसी का काम होता है, किसी का जॉब ही ऐसा होता है कि he has to run around here and there.
जी.
So that is not walking basically. You know, walking you should be brisk walking.
जी.
Okay. And one should try to do at least 2 to 3 times a week.
जी.
Okay, or at least about 40-45 minutes. Okay, that's very helpful.
जी.
Okay, and you should feel like that, you know, you've done something, right? Again, depends on your other factors. There are a lot of other factors are there. Somebody has arthritis, they cannot walk that well.
जी.
But whatever they can do comfortably without causing much more stress, they should do it.
जी. डॉक्टर साहब ये बताएं कि कुछ लोग होते हैं जो डॉक्टर्स के पास जाना अवॉइड करते हैं कि देयर थ्योरीज के टाइम वेस्ट होता है और आई डोंट फील दैट आई एम गेटिंग वेल ट्रीटेड, या मैं छुट्टी लेके जाऊंगा, पे का मसला हो जाएगा। व्हाट वुड यू लाइक टू से टू दैट?
आई नो दिस, देयर आर सोशल फैक्टर्स जैसे आपने बताया है कि छुट्टी लेनी पड़ती है, काम से छुट्टी लेनी पड़ती है, फाइनेंशियल मैटर्स आर आल्सो देयर, but it has to be balanced कि you know, because health is more important. अगर आप healthy नहीं हो तो आप काम भी नहीं कर सकते
जी.
So my advice is that if you have serious problems, hypertension, diabetes mellitus, then you should see your own doctor regularly.
जी.
Take your medicines regularly, because if you are not keeping yourself healthy, then you cannot support your family also.
जी.
Okay, and you cannot work too also. So again, we have only 24 hours in a day and we have to manage.
जी.
और टाइम तो निकालना ही पड़ेगा.
जी. So आप कह रहे थे कि meet their primary doctor as regular as in how often should they see their own doctor?
Depends what is your condition is.
जी.
अगर आप routinely किसी को, जैसे कि there are different factors, अगर आप जैसे you are a very healthy person,
जी.
then I think once a year or once in 2 years is fine. You should get regular blood check. Then there are preventive measures also.
जी.
Everybody should, you know, in females, you know, there are few preventive measures. Every female should get a mammogram.
जी.
At least after 35 years of age, 35 to 40 years of age, they should have at least one mammogram.
जी.
And then after 40, they should have a yearly mammogram. Again, if you have a strong family history of breast cancer in the family,
जी.
then it should start much more early. Depends how many people in your family has breast cancer.
जी.
Okay, then you know, there are a lot of factors here, so this is one of the preventive measure, and it does prevent lot of you know, lot of side effects, lot of complications which can happen if you don't diagnose it early.
जी.
Because if you diagnose early this disease, then the survival rate is extremely very good. Okay,
जी.
अगर आप late diagnose करते हैं तो it's not that good.
जी.
Especially अगर आपके family history है तो it's very 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 important. Routine pap smear. Okay, if you have a genetic problem, again family में uterine cancer है तो you should be more careful. Okay, then in males and in females both, this which is recommended that after 50 years of age, everybody should have a colonoscopy.
जी.
Okay, and if it is normal, then every 10 years one should have it, so it can detect small lesions which can develop into very big colon cancer, which can be avoided. फिर भी अगर मान लो फैमिली में अगर आपके colon cancer है, तो then we do it much earlier. Even some cases, even for prophylactic, if you have very strong family history of colon cancer, there are some types of colon cancer, then some even people they remove their colon also. Okay. फिर आता है आपके prostate males के अंदर prostate cancer, so we do a blood test for the prostate also. Okay. So these are some preventive measures which one should be taking care of it. Then regular blood test may you should, sometimes you have early diabetes, you may not know, but if they find the sugar is slightly high, then you are aware of it, and then you start controlling it, so at least you avoid diabetic complications. So these are routine checkups one should do it. Okay, and if you have problems, then depends on your condition, what you are every 3 months, 6 months, or every month, they should be followed. Depends on the doctor and your conditions and your health problems.
जी, जैसे आप कहते हैं कि if a person is healthy, once a year checkup, it's fine. Is that does it go with blood tests as well? Once a year or every 6 months, a healthy person should have their blood test?
If you're completely healthy, then once a year is fine. You can just do it once a year. Check your cholesterol, check your sugar, your kidneys, and everything. There's a panel comes which checks everything, your blood count. That is pretty normal. Normal standard of your health.
डॉक्टर साहब बताएं, जिन लोगों को फीमेल्स को हीमोग्लोबिन की प्रॉब्लम होती है, उनको अपना ब्लड टेस्ट it's the same way or they should have their blood checked often?
फीमेल्स का सबसे बड़ा प्रॉब्लम जो ब्लड टेस्ट का हो जाए, उनको जो एनीमिया का जो फैक्टर होता है,
जी,
डिपेंड्स ऑन योर मेंस्ट्रुएशन आल्सो.
जी,
some females they bleed very heavily, so their hemoglobin goes low. Okay, and then they should be consulting with their gynecologist. Okay, and if it is too low, then you can get iron supplements, which helps you in maintaining your blood count. Okay, so they should be morely checked. Okay, and again, if females का जो main cause anemia का जो दिखने में आता है, that can be because of very heavy menstrual bleeding. That's what it is.
जी. So now I would like to know about your health insurance. What would you like to say about the health insurances?
Health insurance is it's a very wide subject, and now there are different health insurance in the market. Okay, बहुत लोगों को job से मिल जाती है, but it's a very expensive thing, no doubt about it, definitely.
जी.
अब ओबामा केयर आ गया है,
जी,
which is known as Affordable Care Act, misnomer है Obama Care,
जी,
and there are different models of Obama Care. One is platinum, gold, silver, bronze. Okay, so depends on your financial condition. You can go into that, and it has helped a lot of people. They give financial aid also. फिर बहुत से लोग हैं, they can go for Medicaid also.
जी.
Okay. Then there are insurances people can buy, from job, or that's what is. Depends again, what is your other conditions are.
जी.
That's what it is.
So डॉक्टर साहब, कुछ पेशेंट्स होते हैं या कुछ व्यूअर्स ऐसे हैं जिनके पास इंश्योरेंस नहीं है और वो डॉक्टर्स के पास नहीं जाते. What would you like to say particularly for that?
There are patients who we come across a lot of patients, who don't have insurance, and there is some financial problem also. Either if they have medical problems, they can go to some hospital-based clinics, which are pretty reasonable, and they are like for those patients, and they can get the regular checkup there. And I don't know how much they charge, but they are pretty reasonable for those patients really.
जी. So would you suggest people to get Obamacare insurance? Would you recommend that?
It can be a mandatory also Obamacare now, okay, because he wants everybody to have health insurance, okay. So a lot of people, they don't have any choice also, okay, but it's affordable insurance, and one should definitely take care of their health, and biggest factor is insurance. Because of insurance, then you feel more comfortable.
जी. अगर आप वक्त एक छोटे से ब्रेक का, फिर हम जल्द हाजिर होंगे एक छोटे से ब्रेक के बाद, और आप हमें कॉन्टेक्ट कर सकते हैं एट हमारे ईमेल एड्रेस पे जो कि है healthmatters@gmail.com. We'll be right back after a short break.